what is involved in the study of this particular unit. Now, essentially speaking, we are looking at quality as a topic, but the quality in general, which is going to be looked at from a point of view of discussing in this unit, is focused on understanding what does quality mean, how is quality related to quality of care, and how professionals or practitioners essentially in health and social care sector in settings essentially use quality, which is the implementation of policies and procedures to be able to provide the quality of care which is recommended by regulators, and also helps in meeting the guidelines set by different bodies which are important within this particular sector. Like we have bodies like CQC, we have bodies like National Institute of Care and Health Excellence, we have bodies like Public Health England, and these are the bodies which primarily provide guidelines and legislations or and regulate this sector, so that patients within or people or patients essentially coming to receive services, which is in terms of medical or healthcare services, mental health care services, are essentially receiving them to a level which has been defined and meets the criteria. So individual needs and requirements are taken into account to ensure that the services being provided by practitioners in health and social care allows the patients to get better and get back on their feet. Now, very briefly, what I would also want to do is show you a full screen, because these three documents are going to be important, for the purposes of, obviously looking at doing your assignment. So these three documents would give you a clear steer in terms of how the assignment would need to be attempted, and what are the clear requirements of the assignment as far as the assignment brief or the evidence which has to be compiled is concerned. So let me share the full screen. So if you see on the screen now, we essentially have a unit specification, which is what we've used to discuss and cover the topics and the indicative content given in the topics and the learning outcomes to discuss this particular unit. This is the assignment brief, which is released by the awarding body, ATHE. And this assignment brief is a combination of tasks which have been converted from the learning outcomes into tasks and further sub-assessment criteria, which is what we need to be able to reflect on while compiling the assignment. Now, there are two bits to the assignment brief. The first is an assignment which is focused on essentially preparing a presentation. And this will require you to have a PowerPoint presentation slide with some speaker notes, which is going to be assignment 1. And within the assignment 2, so assignment 1 has two tasks. Task 1 is a presentation, and task 2 will be a Word document. In assignment 2, we have a Word document that will need to be prepared, and that is only task 1, which primarily meets the 3 assessment criteria of learning outcome 3, which is given in the unit spec. Now, what I've done here is I've used both the unit specification, which is this document on the left, the first document, and then the assignment brief that you see to convert that into, so this is what is called the US unit specification, and this is AB, which is basically assignment brief. So I've used both of them and I've converted them into a PowerPoint presentation, which is what we will use for the discussions of our assignment. So in order to make sure that the screen is, you're able to see the big enough screen, what I'm going to do is now just share the PowerPoint presentation so that we can use this to be able to discuss, the discussion in terms of how to collate the assignment. Now, a couple of things that we want to look at, essentially when we started the unit, the aim of the unit was essentially to look at completing an understanding, or basically by studying this unit we wanted to look at having an understanding of what is quality and what does quality mean in the context of health and social care. Now, some of the important points that I would mention primarily would be that we're looking at probably putting together an assignment, or the activities that you would do, task 1, 2, and task 1 in assignment 2. You're looking at probably compiling an evidence in the form of a PowerPoint presentation and a Word document, and this would be roughly about 3,500 words in terms of word count. Now, when you look at doing an assignment, I think this is something which I would talk you through and show you on a Word document in terms of how you would go about essentially doing the assignment. So if I'm in your shoes and I'm looking at doing the assignment, the first thing what I'm going to do is write the name of the unit. And then after that, what I'm going to do is primarily look at writing the tasks which are required to be done in the assignment. So essentially, when I look at this, I'm going to kind of, just format assignment 1, and we're looking at task 1. And within that, there are 2 or 3 tasks that I need to accomplish. So what I'm going to do is probably put those tasks here, and then obviously space out some of these as we go along in terms of, completing and putting the evidence in. At some stage, what I would look at is putting task 2 down, and in task 2 there are a couple of bullet points which are given out as A, B, C, D, and essentially what again I will do is I'm just preparing a brief working document which I will be using for the purposes of putting the evidence in as I do my assignment. And then I will go in and put assignment 2 so that we know that we have started assignment 2. There is a task 1 in the assignment, and obviously there are 3 bullet points which I'm going to put here, and they would essentially be looking at the 3 tasks. So here, if I look at renaming, this says 3.1, this is 3.2, and this is 3.3, because in the Word document, we generally see that the assessment criteria are labeled towards the end. So this was 1.2. This is, if I look at this, 2.1. This one is just basically, putting the structure of the document right now, 4.1, and then 4.2. And then the first 3 essentially were looking at 1.1, and this was 1.3. So if I look at this is 1.1 and 1.3, and this is 2.3. And that pretty much looks at, writing all the tasks down that we know are required to be completed in the assignment. What I'm going to do is also go in and insert page numbers just to format the document. So the page numbers, are in. And then what I'm going to also do is, as I go along, do the assignment, I'm also going to look at creating a table of content. So by looking at, automatically selecting this as table of content, what I want to do is so that, we know exactly how the table of content would show all the pieces of evidence that we've got. So just quickly formatting this. So this is 1.2. Sorry, some of it does away with the formatting. 2.1. And so on and so forth. So let me just quickly complete this so that we know what we are up against in terms of compilation of evidence. And this could be something that you follow as a standard practice when you do pretty much any assignment in this particular course. So the assignment preparation and the way you submit your assignment pretty much will be more or less the same all across, whether you do an assignment for this unit or you're doing an assignment for any other unit. So that bit is now pretty much in. And what I also need to do is put some details down towards the end, which will essentially be references and bibliography. So things that I'm going to read and paraphrase in my own words, and then obviously put that across, is going to be shown as bibliography, things that I essentially quote from other authors and essentially use them, as direct quotes or as, in-text referencing, would be referencing using Harvard referencing. Now, once this bit is ready, what I'm also going to do is draw up a table of content. So essentially, that would mean that this document is pretty much going to be like a final document, which will be neatly formatted, gives me a full idea that what all tasks have you covered. just going to go and insert page here so that it goes to the next page. And we know that this is how the assignment should essentially be looking like when you complete this as a document. Now, because there is a PowerPoint presentation involved, essentially, in the first assignment and in task 1, you might be looking at putting some of the bits of evidences here, which would essentially be like speaker notes, but you would also develop a PowerPoint presentation. And that would be a couple of slides, I would say, because it covers assessment criteria 1.1, 1.2, or 1.3 and 2.3. You're looking at about 10 slides with about, say, 500 to 700 words in terms of, completing that part of it. Now, this is how you would essentially look at, doing an assignment. And this is how you'll be compiling your assignment document and then submit it for the purposes of evaluation and marking. Now, if I switch you back to the presentation, what we are looking at is going back to our discussion in terms of, the PowerPoint slides. So some of the bits which I've explained here as important points are essentially what I've shown you how it needs to be done. So one of the clear requirements is in the assignment brief is that we need to be looking at taking up a specific organization, whether it's the NHS, whether it's a care home or any sort of a healthcare setting organization. That is something which is going to be required to cover the context of a specific health and social care setting. Now, it'll be good practice to basically do a bit of an introduction about that organization. So if I look at going back to the Word document, and what I would do is I would basically put in a word called introduction to the organization, and that could be anywhere between like 30 to 50 words explaining why you've chosen this organization for the purposes of doing the assignment. Now, give proper headings and subheadings. So that is what we have done. We have made sure that the document is presentable, it's professional, obviously line spacing of 1.5, looking at font size 12. We are looking at putting at least or including at least 12 to 15 references because at some stage your assignment is going to be checked for plagiarism, and it needs to be conforming with the requirements of the college policy, which is less than 20%. And at the same time, in some cases, when you read and you paraphrase and you write that text in the document, that will be termed as bibliography, or you'll be writing and mentioning the details of it in your bibliography. And when you look at taking exact text, theory, key frameworks, from books and handouts and even UK Versity slides, you're going to be referencing them using Harvard referencing style, and they would be termed as references towards the end of your document. One of the other key things which I'd quickly mention is that there's an assignment declaration that you need to complete, and this declaration primarily is a conformance to saying that this is your own work, you've not colluded with anybody, this has not been plagiarized, this work has not been done by somebody else for you, and all the work that you've included in your assignment for the purposes of verification and submission is basically your own piece of work, and you've followed the guidelines as provided by the awarding body and the college to be able to complete this piece of work for the purposes of submission. There is no grading in this assignment. It's only a pass, and the pass would mean that you've achieved 100%. All tasks will have to be attempted. And this is a Word declaration that you can download from the Moodle. Should you wish to fill it up using a Word document, you can sign, put your name, your student registration number, the course name, and the assignment 518, Managing Quality in Health and Social Care. Check all these boxes and a signature towards the end for the declaration. You can also go and fill up this declaration online on our website, and that would allow you to fill the declaration in for all the units in one go, so that this is a paper compliance related paper-based process, and that can be done away with by filling this declaration online as well. Now, when we look at going into the details of the assignment brief, what we are essentially looking at in this case is primarily focusing on let's say discussing some of the tasks and activities which have been given. Now, the first part that we looked at essentially was, it says you should carry out the task in a specific health or a social care setting. And that's where the need for an organization comes into view. And you will have to have an organization in mind. You can't just say NHS. I would suggest within the NHS, you pick up a hospital or pick up an organization that you are aware of and can research on the internet to gather some information and use that organization as an example to show application of key theoretical aspects when you're writing the assignment. So if you recall, in our case, we have done the discussion of some of the learning outcomes of the unit by using a hospital. In my case, we put in Wythenshawe Hospital, which is based in Manchester, and we've looked at some of the bits in terms of bringing the aspects of the hospital, the vision policy, the quality policy, the last CQC report in terms of their inspection. And those bits have been included in the slides on the presentation that I've done and covered some of the learning outcomes. So this allows us to put a bit of a context to the role of a nurse or a healthcare professional and relate it to an organization. And it just generally looks at presenting some of the evidence that you create and then present for the assignment in a much more better fashion, in a manner, because you're relating it to an organization, you're relating it to a particular role, and that shows your understanding of what you've gained and learned from this particular unit. Now, in this assignment 1, there are 2 tasks. First task is talking about creating a presentation, and that would be a PowerPoint presentation that would be required to create. I would say look at no more than 10 to 12 slides. And in these in this presentation, you're going to be looking at discussing about the various stakeholders which are present within a health and social care setting, and what is the impact of poor quality of service on these stakeholders. And the second task looks at, in fact, the third task looks at analyzing potential barriers to delivery of quality and healthcare services. Now, obviously, you should be looking at presenting this presentation using a PowerPoint slides, about 10 to 12, and towards the end of your PowerPoint slides, you need to include your bibliography or your references that you have used to compile that information. Now, if I look at how you would go about compiling the evidence for this task, the task 1 talks about PowerPoint presentation. So if I just look at then showing you, say, for example, a full version of the screen, so that you are aware that, how do we look at creating this presentation, would be to try and go about, creating one, just like we've done in the case of a Word document. Let me share my full screen. And that should mean you should see pretty much now 2 PowerPoint presentations and the Word document that we created. Now here, because it talks about assignment 1, task 1, and then I would say submitted by, and I would put my name in, just your student name, and this would be covering the task 1 of the assignment. And what I would then go about doing is basically look at adding a few slides that I want to look at. And the first part of the task talks about essentially this bit. So I'm going to put this here, and obviously try and minimize some part of this. So this would cover assessment criteria 1.1, and so basically consider and explain quality from a stakeholder's perspective. And then if I look at the other task, I'm going to copy this and then split this into maybe another slide, and this would be essentially task 1.3. And the other part talks about assessing the impact of poor quality service on stakeholders. Now, and then similarly, if I look at the last one, I would probably put that on the slide in terms of a heading, and that would be essentially the task 2.3, which is about analysis. Now, when you do a PowerPoint presentation, what you'd be able to do is make the slides and put some notes here, which will be termed as speaker notes, which are going to be used for explaining the slides that you have done. Or you can essentially also put your speaker notes in the Word document, which is going to come here. Now, this is how a presentation, would be made, because towards the end, this is something which is required, and then it would be about 10 to 12 slides. So you're looking at maybe topic here when I talk about in discussion in terms of what are the stakeholders. So first of all, I would talk about in this case, by taking a specific organization. So when I say a specific organization, what I'm going to do is do a bit of introduction here. So the first slide in this case would become introduction to Wythenshawe Hospital. So basically a brief introduction about the hospital, which trust belongs to within the Manchester, what areas it caters to, and what specific department you're looking at talking about when you're referencing your tasks that you're doing in the assignment. And then at some stage we would go into some of the assessment criteria, which is primarily looking at talking about the different stakeholders in the in terms of the health and social care setting. So here I would what I would do is basically put a table down, and this table essentially would go into a new slide. And what I would want to do is essentially have this briefly use this table to basically discuss what is the quality perspective from a patient's point of view, from practitioners' point of view, family and friends, and obviously from a regulatory point of view. So this is basically stakeholders which are involved, and they have a say in how the quality is managed within the organization. Now, this part of the presentation would essentially mean that we are looking at putting a few slides in. So you might then, after this, put an individual slide in, because here you're looking at basically, just a key brief of what the quality of care is. So for example, here 6 C's of care: person-centered approach. And then if I have to discuss this in a bit more detail, what I would do is basically have another slide. And here I'm going to talk about that the 6 C's and the person-centered care basically conforms to meeting the needs, providing the care and meeting the needs of the individual which is receiving this particular service. So you could put 3-4 slides in, and that would cover your assessment criteria 1.1. Then going to 1.3, which says assess the impact of poor service of quality. Here we are going to be discussing, some of these factors, which will be reputation of providers, accountability, regulator, and regulator like CQC, and sanctions if they are not meeting the criteria. And then what is the impact? So in this case, stakeholders, say for example, in this case, if I just take patient quality of care is compromised, and this could lead to fatalities. So what could be the end result if, compromise? So for example, if the quality of care is compromised, what could it be resulting into, which is fatality? So you'll need to put some points here which you can refer to from our slides, and this would help you cover the task 1 of the presentation. And that would also cover allow you to make the presentation, and at some stage that would cover the task 1 of the assignment, which is given in the assignment brief. Now, going to task 2, here there are a couple of assessment criteria. It basically has all these assessment criteria here. So what the assignment brief is now saying is that you have gone ahead and made the presentation, which was a document required for the senior management. Now, with that document that you presented, the senior management team in that organization, say for example within your hospital, has now decided to conduct a review of organization's quality system. And as the work has to be completed, what you are required to do now is to help the senior management team, SMT team, in order to prepare a report. And the preparation of the report is basically looking at you writing evidence for these tasks, which are given as bullet points A to E, which are essentially assessment criteria 1.2, 2.1, 2.2, 4.1, and 4.2 of the assignment brief. Now, the couple of slides that I put together here in terms of giving you some guidance in terms of what you need to talk about. So the first point talks about analyze the role of external agencies in setting standards for the sector. So here you need to talk about CQC, you need to talk about National Institute of Care and Excellence, and or Public Health England. And if you talk about these bodies in brief and what standards they set, for the purposes of, quality of care and how it is delivered, they would be, useful and will cover task 1.2. Now, if you recall, some of you, when we did the, the presentation of unit, of learning outcome 1, what we covered in that presentation of learning outcome 1 was I'd shown you an example of how, NICE basically has, the standards published on their website in terms of the key care standards which they say. And these standards were essentially 160 odd standards which primarily are prescribed, and then there are a number of guidelines which are also prescribed by them in order to ensure that these then can be put into practice for the purposes of providing care to the patients. So you would need to cover some, maybe cover one example by taking one example, and they would essentially be the standards, one standard which will essentially help you, achieve, for example, the task 1.2. So if you recall, this is the presentation that I've opened up on learning outcome 2. And in this presentation, if you click on this particular link, you would see that there are these standards which are guidance given by NICE. And in this, if you see, there are these standards which are given. So these are all the quality standards which are prescribed by NICE, and there are a total of 160 such standards. So quality standard QS 109. Now you might want to pick out one and talk about that standard in a bit more detail, and that would also explain task 2.1, which talks about how do these standards help in measuring quality of care in the health and social care setting. And that would be covering task 1.1 and 2.1 in detail. Now, for the next task, which is talking about 2.2, it says different approaches to implementing quality systems. Now, here we had discussed in learning outcome 3 or learning outcome 2 itself, different approaches that could be taken to put into practice, the regulators' policies and procedures, and ensuring that, at any given stage, we are conforming to quality side of things with regards to regulatory, authorities and legislation. So here, some of the things that you could discuss is continuous improvement, which is very common within health and social care setting. Analysis, SWOT analysis, which is done by the management and the quality manager, and regular audits and risk assessments, which are done essentially to ensure that the quality systems are in place and they are helping to deliver the quality of care which is required for patients. And you could also talk about an approach of total quality management, and you can refer to some of these slides here that I mentioned, which basically help in covering the task 2.2. The last part of the task in assignment 1, task 2, is discuss the impacts of, service quality of involving users in these services. So here, the discussion needs to be ranging in about, say, 150 to 200 words. And what you have to do is talk about the role of users and patients in terms of utilization and expectation of these services. So this was something that we discussed in learning outcome 4. And if I go into this particular presentation, if you recall, we use things like surveys, questionnaires, evaluating standards, and they are the ones which are used as tools and techniques to be able to measure service and quality of service which is being delivered to patients. And this would allow you to cover, assignment 1 of the unit and task 1 and 2, which is given in the assignment brief. Now, in assignment 2, it is talking about that, your senior managers have conducted a review of the quality policies and procedures. The senior management team has now recommended a range of, corrective action plan, which they are looking at putting into the organization, and they want some feedback on it. So with this in mind, the scenario in mind, there is a requirement for you to complete tasks 3.1, 3.2, and 3.3, which are bullet points A, B, and C. And here, what I would suggest that you need to do is, for task 3.1, we need to discuss a policy and procedure from a particular organization in order to discuss the aspect of how the effectiveness of policies and procedures is done within the organization to keep quality and regulatory regime conforming to the regulatory regime in place. So here I would suggest you talk about quality policies. So for example, health and safety policy, safeguarding policy, this is what I would suggest that you need to talk about and relate them. So if I just reorder this, so I might say talk about, health and safety, health and safety policy, and or talk about safeguarding policy, and then relate them to the 6 C's of care and the person-centered approach, which practitioners need to follow in terms of implementing these policies and procedures within the healthcare setting or the healthcare organization. And that would allow you to complete this particular task. Now, for task 3.2, we are looking at factors that influence achievement of quality in an organization. So here I would suggest that you need to talk about, things like factors which we discussed in learning outcome 3, and we discussed factors which were basically resources. With these could be financial resources, it could be administrative resources, and we talked about skills which are required essentially, which need to be there in terms of the staff having those skills to be able to teach. And let's say in our case, in order to effectively teach and deliver the sessions, the staff needs to have a teaching qualification. Similarly, in the case of health and social care purposes, staff would need to have proper skill in terms of training. They need to have resources in terms of financial resources, administrative resources, infrastructure resources available, and then there should be appropriate training and development provided from time to time, which helps in the achievement of meeting the quality guidelines within the organization. So here you could use points like resource availability, appropriate skill, training and development of staff to cover the criteria 3.2. The last criteria in the assignment talks about ways in which organization could improve quality services. So here I would suggest that you need to talk about things like regular trainings, up-to-date documentation, implementation and adherence of policies and procedures related to regulators like CQC, and then proper staffing in terms of resources. That if you recall that we had discussed that if there is a ward and in the ward there are so many patients, if there is a ratio of 1:3 per nurse, that or 1:5, and if that ratio is not maintained, then obviously some of the services being provided by nurses or healthcare professionals can slip, and this can lead to fatalities. So when patients are transferred from ICU to general ward, you normally see staffing ratios being maintained in order so that the patients are fully covered in terms of both providing care and also ensuring that the requirement of their care is met by taking into account their preferences, their culture, their background, and ensuring that the service or the care in this case being provided is meeting their particular requirements. And that would allow you to essentially cover this particular task, which is the 3.3. And I would suggest for most of the tasks which are to be done word count wise, most of the tasks which are to be done individually as a Word document or as Word report, I would say not more than 200 words would be required. So because the overall limit that I'm suggesting for the assignment is about 3,000 to 3,500 words, with one PowerPoint presentation having 500 to 700 words as speaker notes, your word limit should be conforming to that guideline of between 3,000 to 3,500. If you're going over and above this, that means you're writing, you're maybe covering the topics in a bit more detail, but that would also mean that you would need to paraphrase and appropriately reference your work so that your similarity does not go up. Now, there are resources which are given up on the Moodle, and they would include things like the books, for this particular unit. And in some cases, the handouts that I've created are also available for you to be able to go in and obviously use them for the purposes of your assignment. Now, last but not the least, what I would want to mention very briefly is that you should focus on command verbs. Now, in the assignment brief, one of the clear bits that you will look at, and if I bring this into focus by showing you the assignment brief, what you're essentially going to see is that, the assignment brief has certain words like analyze, for example, evaluate, discuss. Now, these are words which typically basically define, what is required to be done in that particular task. So they give you a bit of a clear steer in terms of what is required and how things have to be answered, or what evidence and how much evidence in terms of how much is too much or how much is too less in terms of evidence has to be compiled. So when we know the definition of these words, it is going to be becoming easier for us to do the task correct the first time, and that will also allow us to essentially, put this into perspective. So when I talk about analyze, what does analyze mean? We are looking at breaking the topic down into separate factors, talking to ensure that how these factors are related. So here in this case, if we talk about the role of external agency, we would need to talk about CQC. We would need to look at mentioning one or two care standards that they prescribe and how these standards are then maintained, in a healthcare setting, which is the organization that you take of choice, whether it's the hospital, a care home, and how these care standards contribute to running the setup within the health and social care sector is what will be the analysis required. or compilation of evidence required for you to be able to meet analysis. Similarly, when we talk about some of the other tasks, it says consider or explain. Now, explain generally talks about we setting out the meaning of the word or the phrase in detail. So here in this case, it talks about stakeholders, it talks about quality. So you will need to talk about what is stakeholders, what is the context of relating stakeholders to quality. And then the other bit would be to talk about by giving an example that, okay, if we talk about, practitioners and we talk about, say, patients, the stakeholders of quality in this case is the user's requirement being met. From a nurse or a healthcare professional, you're looking at taking into account the 6 C's of care, compassion, courage. Those bits will have to be put into as an example to elaborate and meet this particular criteria. So there is a particular document that I have, on the Moodle, which is in the start of the course section, and that particular document is defined as command verbs. Now, in this document, if you see, there are meanings and definitions of all the command verbs given, and generally you would see the higher the criteria of the command verbs, they typically tend to require a bit more evidence in terms of word limit that you need to put in to be able to complete and achieve the task convincingly. Now, when we look at going back to the presentation again, just very briefly, I have also suggested a brief amount of word limit for the task. So for example, if you have words like explain, define, describe, you're not looking at putting more than 100 to 125 words to achieve that task. When you have assess, examine, clarify, or analyze, you're looking at 175 to 225 words, which is like about a page and a half to be able to write. And then when you have higher order command verbs like compare, contrast, or evaluate, you're looking at about 2 pages for evaluation, because here you have to put in advantages, disadvantages, put in evidence which helps you build arguments, and then conclude why you support this particular, let's say, opinion or objective, or why do you support this, evidence, and that would help you cover, the evaluation task. Make sure you're referencing your work. Make sure that you're, looking at keeping within the word limits, because although there is no statutory word limit for you to complete the assignment, but word limits are generally given because it'll help you, compile evidence which is going to be related to the task, related to the question which has been asked in the task, and you are not generally covering or putting in material which is not related to the unit or the subject. And that is where the conciseness or the word limit of the suggested word limit of the assignment essentially comes up. Now, if you do refer to presentation slides and bring them in your work, then they would need to be referenced towards the end as a bibliography or as a reference, and you would put, say, multidisciplinary teams. If you use some words or text from LO1, LO2, whichever slide, put LO1 slide, put the numbers, and then say UK Versity published on such and such date. Now, what I would also want to do is, with regards to the timeline for the submission of assignment, today is the 30th. I would suggest that if you take not more than, I would ideally say 2 weeks, but generally seeking not more than 4 weeks to be able to submit the assignment for this particular unit. And that assignment submission should happen to the email learnerwork@ukversity.co.uk. And this would mean when you submit the assignment, you are going to get an acknowledgement receipt. And within 3 to 4 working days, we'll give you a feedback on the assignment to say whether you passed, met the criteria, or if there are bits and pieces which are shy of, or in some cases missing, then we will give you some directive feedback to say, could you add this, change this, amend it, and then resubmit. And that would help you complete and achieve this particular unit. So do watch this particular assignment session. And then what I will do is the 2 documents that I've created as example documents, one which is the PowerPoint presentation, and then the, what do you call, the Word document. Essentially, what I will do is I will upload them onto the Moodle, so that you have it for the purposes of reference, and you could use these documents essentially to help and complete the assignment. So assignment discussion document, which is what I will put this as. And if you have any further questions with regards to this, then do write an email to me at raman@ukversity.co.uk, and I'll come back to you with maybe more details or anything that you need in terms of moving ahead with regards to completing the unit. There is also a sampler assignment which will be available for some of you who want to look at how the assignment looks like, what is the completed assignment, an assignment, how it needs to be compiled or completed and it looks like. This is going to be a general assignment which is going to be available primarily on the assignment on Moodle, and this will only be for reference purposes. So for those of you who want to look at for those of you who want to look at this particular assignment, feel free to look at that assignment for the purposes of idea. And then once you're done and once you've completed your draft, email that to us at Learnerwork, and then we'll come back to you with some feedback. So if there are any questions at this stage, feel free to ask me. Otherwise, what I will do is end this session. I'd like to keep it crisp so that people, those who haven't been able to join today, at some stage, if they need to watch this session, will find it useful for them to be able to get into doing the assignment. Thanks so much for attending, and bye for now.